Namaste, everyone. I welcome you all to today's Yes Talk. The title of today's talk is ADHD, the phenomenon matters more than the label. Our guest speaker today is Miss Ashwini Londhe, who is a child psychologist holding master's degrees in clinical psychology and in counseling and psychotherapy. Since 1994, she has worked in various schools as a child psychologist and a counselor in Pune and Bangalore. In this long career, she has helped children with different types of learning difficulties and psychological challenges. Her work on teachers as first line counselors has helped teachers in early detection of various psychological concerns of the students. At present, she is working with Samvit Research Foundation, studying the impact of Anapan meditation on the sustained attention span and DPCL profile of the students. Ashwini ma'am, we welcome you. Thank you so much for being with us on the Yes platform today. Look forward to an interesting session with you. Over to you.
Yes. So, namaste to all. And Bijlani ji, thank you for giving me this opportunity. I'll directly go to the presentation. This attention deficit hyperactivity, which we call ADHD. As you have heard in introduction that I'm working in this field for a long time. And since then, it was like the awareness about psychological issues or mental health problems was there. Now, the difference is that parents, they got to know about many things from net or from the social platforms. And now they come to us with the names that my child has ADHD, my child has autism. So even without going for any particular assessment or anything, they just come to us. The awareness is good. And even the work what the psychologists and the researchers are doing in this field is really marvelous, exemplary. But still, it's like we need to know what exactly is ADHD. So phenomenon or even the neurodiversity, what I think Mitu Palji has taken a session, very nice session what she had. And this problem also falls into neurodevelopmental disorder kind of a thing, which the child has from the birth. But usually, as I said, because of the information what parents get on uh, different social platforms or from internet, they feel that every problem or every behavior of my child which doesn't fall into particular way or particular pattern will be attention deficit hyperactivity or maybe sometimes autism. And sometimes even they say that my child has really gone mad. So somewhere we need to make them aware what exactly is the term, what exactly they are saying, and what is the difference in the serious problem or a general deviation in the behavior, and how we can deal with all such problems, like starting from very simple psychological issues to some serious cases of psychotic problems. So I'll start with this ADHD. Now, for any psychological problem, when we say that psychological problem is there are three important points which one has to remember. That what is the intensity of the problem? Is it causing any trouble for that child in the normal interaction or in normal day-to-day living or in his daily activities? So if it is really stopping the child or if it is really becoming some difficulty for the child to follow the routine, then it is definitely intense problem. Then what is the frequency? If it is happening on everyday basis, if it is happening regularly, and usually we say that if this problem or any psychological problem is there, then it has to manifest itself at least for 6 months before we say that yes, there is a problem. So at least 6 months time we have to give, because sometimes because of the traumas, because of some family situations, or maybe because of the academic pressure and stress, the child starts behaving in a different manner. But as and how the situation recovers, the frequency also goes down. But if the child has a serious problem, then uh, it doesn't subside just like that. It needs some remedy, it needs some help. So frequency also is very important. And the next thing is consistency. If it is happening consistently over the time, like even though the situation has changed, even though the people around that particular child or that person, they have changed their behavior pattern, they have tried their best, but still the particular behavior pattern is really there, then yes, there is a consistency and the child or that person needs help. So these 3 points are very important when we say that the person has or the child has some psychological problem. So understanding the phenomena. As I said, when especially the mother reads some content over net or on any social platform, she feels that yes, my child has this, my child has this. And she doesn't go usually into the reasoning or the causes, what has actually shown in that behavior, for that behavior. So, overactivity usually is confused with hyperactivity. So, what is overactivity? Overactivity is a behavior which the child shows uh, other than his normal pattern of behavior, or it's a kind of attention seeking behavior what child shows. He will shout, he will scream, he'll throw things everywhere, or he will not listen to the parents what they are saying, or he will do something else what when they are expecting him to behave in a certain manner. So this particular behavior, if the mother sees for, or if the parent or if the relatives, they see it for over a week or 10 days time, they feel that yes, the child has some psychological issue. And they usually don't go into the cause of that particular behavior. Especially now the gadgets, like screen time, when it has increased, uh, that particular screen time actually induces the symptoms of ADHD. But it is not ADHD. They are just the symptoms of ADHD, which can be cured. So it is different when we go into the etiology of that particular behavior pattern. Another situational reason is like when the child is in school, usually from pre-primary itself, we have seen that the child is sent for the tuition. The child is loaded with lot of expectations. The achievement is expected. Some parameters of achievements are there, so that causes lot of stress to the child, and the child goes for overactivity. If there is lot of comparison happening, one of the behavior patterns shown by the child is overactivity. Sometimes the child is over pampered. Everything he or she gets without asking. So that also causes overactivity, because if the child doesn't get whatever he is asking for or whatever he feels, then the child shows overactivity. And the hyperactivity is a neurodevelopmental brain disorder which the child gets from the birth, and it goes to the adulthood if not treated or if not been addressed properly at the right time, and it stays lifelong. So it is totally different than the overactivity. This overactivity has limited time duration, whereas it continues lifelong. Hyperactivity continues lifelong. It hardly has any impact on the study or social situations where the child mingles with others. Usually, this overactivity is seen only in the house or maybe at certain places in the school. But when the child is on the ground with the friends or he is involved in some game, then that overactivity is not seen. He enjoys everything, whatever he likes. But the child who has hyperactivity, he carries the impact of that particular problem in his studies and even in the social situations. At home, definitely he shows certain behavior pattern, but even outside, when they go for some social gathering or family get together, or even for some parties or like birthday parties of friends or some guests, when they come home, usually the child cannot control those impulses, what he suffers. This is about the hyperactivity. Then, for overactivity suggestions, clear and firm instructions from the parents or discipline, particular disciplining pattern, if it is continuous in the similar manner, then the overactivity is seen reduced. But for hyperactivity, these suggestions or clear instructions, they work for very little time, or maybe for few hours. But after that, it it bounces back. So it's like the medication or the therapy for a longer time, or the special attention, one-to-one attention, or some special educators sessions are required for the behavior pattern or inattentiveness, or we'll see that there are different types of ADHD where combined symptoms are there when the hyperactivity, impulsivity, and inattentiveness, they come together. So for each of this problem, they need a particular professional help, which is not required in overactivity. It is observed, like overactivity is observed both in girls and boys, whereas the study shows that hyperactivity is found more in boys than girls. So, what are the types of ADHD? ADHD is seen as hyperactivity or impulsivity, where the child is unable to control his movements, body movements, and even when uh, that particular thing is happening to him, his behavior is totally uncontrollable because it is controlled by some impulses which he is getting from inside. So it is not intentionally what he is doing. He is unable to control his uh, particular behavior pattern. Like usually, if the hyperactive child is there in the class, the partner or the child who's sitting by his side, they usually complain that this boy is pinching, this boy is actually poking, this boy is pushing, or this boy is sometimes throwing things. So these are the impulses. If the child is really hyperactive child, then these are the impulses which the child is unable to control. So many a times we say that this type of children, they need some shadow in the classroom. They need some assistance in the classroom. And usually we pair the child with some other child who is understanding or who can help this particular child when the impulses are there or when the child is unable to control himself. Then this inattentive type or the passive type of ADHD, which is seen more in girls. So this inattentive type is like where the child is sitting in the class. But whatever the teacher is saying, or even at home, whatever the parents or the relatives are saying, the this particular girl will not be listening to them, and she will not understand what they were saying, or she will ask again, like, what you were saying, something like that. So it actually irritates the other person because it happens very frequently. And that is one of the type of ADHD. And here in this particular type, the child is very silent, is to himself, or she is to herself. So they are not harming or hurting others, or they are not behaving in hyperactive manner. They just by themselves, they will be daydreaming, they will be, it is called daydreaming, but they are inattentive, they are just not in that particular place where they are physically. The next type is combined type of ADHD has both inattentive type and hyperactive impulsive type. So actually, this DSM, what we refer for the diagnosis of any psychological problem, that is Diagnostic Statistical Manual, which is created by American Psychologists Association, APA. So they have given, now in the revised edition in 2022, they have given ADHD on the spectrum. So passive type comes usually on the mild uh, level. Then moderate is somewhere hyperactivity and impulsivity. And severe form is combined form, where both the problems with their all the set of symptoms are seen. Then primary type of ADHD. So ADHD is the primary or the main problem which is combined by other problems, like learning problem will be there, or uh, uh, emotional problems will be there. Like they will be very anxious about they being in the crowd, they being in the social group, because they are aware about their behavior pattern, or the scoldings, or the negative comments which they get for their behavior. So, ADHD will remain as a primary problem or primary type, combined with other learning like academic problems, or with the emotional or psychological problems. Then, uh, in the other type of neurodiversity, what we have seen earlier in one of the sessions, autism. Autism sometimes come with ADHD. So this becomes a secondary problem, whereas autism, all the symptoms of the autism, they are at the primary level. They are main problems, whereas they are combined with the secondary problem of ADHD symptoms. So these are the types of ADHD what we see in children. Then what are the symptoms which are given by DSM? This is the fifth edition. What I said earlier, it was in 2013. It was revised and again revised in 2022. Uh, so uh, the list of symptoms what they have given to say that the child is hyperactive child or hyperactive attention deficit child, we look for some 9 symptoms in the child. And if the child meets the criteria up to 6 symptoms, if we can see that there are 6 symptoms seen in the child, then we can say that yes, the child has a problem of hyperactivity. So in the classroom or even at home, even at the social situation, the child leaves his seat frequently. It's like when he is expected to sit at one place, even when the child is watching TV, or when the child is doing his studies at home one to one, like a mother or the parent or some elder is sitting by the side and the child is doing the work, still the child is unable to sit at one place. for a longer time. He will get up, he'll play, he will do something, then he'll come back, then again he'll get up after a few minutes. So this is what is seen even in one-to-one. And in the school, it worsens when the ratio is 20 is to 1 or sometimes 30 is to 1. So it becomes very difficult for the child to sit at one place. And many times teachers complain to us that, see, the child is roaming all the time as if he is supposed to check all the students. So he is not sitting at his place. So that is the main concern what the teachers have in the school. Then, uh, even though the child is sitting for few minutes, he will be keep tapping on the bench, or he'll be doing something with his hands. As I said earlier, the child sitting by his side, he will complain that, see, he is throwing my things, he is not keeping his things also properly. Then they are unable to write properly. Their handwriting will be illegible. So this is because of their fidgetiness, what we see in the child. He is always seen fidgeting. Even if he is standing, he won't stand straight like any other child. He'll be fidgeting all the time. Then running and climbing when it is not expected. Usually, the children of 4 and 5 years, they mainly the complaint from the parents will be like they are climbing the window grill, or they are climbing the grill which is put in the balcony, or wherever they go in any situation, they'll be climbing the stairs or running all around. So these are the complaints what uh, are seen in the child as one of the symptoms to say that the child is hyperactive. Then he cannot sit quietly for longer time. One of the main symptom what we see otherwise, even before going to this list of symptoms, is like they don't have eye to eye contact. Very rarely they will be looking at you when you call them. It's like they will be looking here and there all the time. When you call them, they'll just give a glance and again they will start looking here and there. So even with eye movements, they cannot fix it for a longer time. And body movements definitely are uncontrollable. Then they are often on the go as if driven by the motor. So always active. Then often talks excessively, but mostly their speech won't be clear because they have so many thoughts running in their mind all the time. So it becomes very difficult for them to speak clearly. So speech difficulties also are seen in these children. Then in the school or at home or in social situations, it is like if you are asking something, before you complete your question, the answer will be there. It won't be according to your question, or it won't be according to what you are asking. It can be anything because the child is not waiting for that question to complete and understanding and then answer. This particular process, the cognitive process, is usually observed as disturbed in ADHD children. Then in the school or in the park, wherever they are going, it's very difficult for them to wait for their turn. It's like when the other children will be asked to move in a line, it will be like they will go in the front, sometimes they will go in the back, and they will be always on the move. And if any game is happening, or if any particular situation the group is enjoying something, these children will go and interrupt that game, or they will just disturb that particular pattern, what is happening over there, with their ideas or with their impulses. So it becomes very difficult for the peers to adjust them in their group. So usually they are being segregated, and it happens very naturally and in a flow, that the other children start ignoring them or not taking them along with them. So we always recommend that one shadow or one adult supervisor should be there for such children, to remind them about their expected behavior pattern or help them from getting injured, because all these activities usually lead even to the injuries happening to to themselves. So shadow is required for all these symptoms what we see. Usually we guide the parents also, and many mothers, they opt for becoming a shadow for the child. Then there are inattention symptoms. Again, there are some 9 symptoms which are given, and we look for uh, at least 6 symptoms to call the child as he is passive ADHD or inattentive ADHD symptoms are there. So it is because of their inattentiveness, they usually lose their the content what is given to them or what is said to them. As I said earlier, even at home, the child is totally lost in his own world, and if you say something, you get me this or you take this, the child usually asks the second time that what you are saying, what I have to do, or something like that. So it is very careless mistakes or losing out on the major content of the conversation happens with them. Then sustained attention is a problem. As I said, even eye to eye contact becomes difficult for them. So sustained attention will be the goal which is really far for them. They usually are in their own world, so they hardly listen to the instructions given. And again, I'll say that these symptoms usually are seen in other children also who are overactive, or sometimes the attention deficit disorder. That particular problem also has all this inattentive symptoms. Disorganized work and has poor time management. They usually lose out on their particular routine or schedule or time where and when they are expected to do something. So they really face this problem, especially school going children. And it is seen that if the treatment or a particular remedy is not given at the right time, this goes even in the adulthood, and these people, now the adults, they have the problem in professional adjustments. So many times they lose their job very frequently because of this disorganized work or missing out on the important content or even poor time management. Then they just try to avoid the tasks which are required for sustained mental efforts. So it is very difficult for them to go with the complex instructions, or if we are giving 2 or 3 instructions at a time, it is very difficult for them to segregate or analyze those instructions and then synthesize everything and uh, do that work or complete the task given. So it is very when the therapy is given, ABA therapy or the occupational therapy, everything is divided. All the instructions are made in a simple format. Usually, we make cards and we give them the cards and give them the instructions one by one. Because the complexity of information or instructions is usually difficult for them to digest or to work with. Then they are like very good starters, but very difficult for them to sustain it and finish it up to the end. then they get easily distracted by any external stimuli, even if any sound comes from outside or even if anything is happening around them, usually distracts them very easily. There is a very good book which is written by one Japanese author. Toto-chan is the name of that book, and that particular girl, that author herself has written her own experiences as when she was a child, how it happened to her, and all the behavior pattern what she has mentioned in that book actually fits in all the symptoms of inattentive type of ADHD. And she has written in that book that how she was thrown out of different schools uh, after a very short time span when she spent there, then after a month, maybe sometimes after 15 days. And that book actually is based on the timeline of Second World War. So since then, this inattentive type of ADHD was seen, and actually the children suffered a lot. Then forgetful in daily activities, as their attention is not there on that work or their instruction or given uh, any important task. They it's like they forget because their attention is not there. So whatever they receive becomes filtered, and they do only the thing what is their what they feel comfortable with, and they go with that. So any other work given to them or any other task given to them, they just forget because that doesn't fit in their schedule and their comfort. So these are two types, hyperactivity and impulsivity and inattention symptoms, which are been given by DSM. And if we combine both the symptoms, that is 18 symptoms, out of 18 symptoms, if the child has some 10 or 12 symptoms uh, in that child for uh, very long duration, more than 6 to 7 months. And actually, it is very difficult to diagnose such children before the age of 4. Because earlier to that, children are very inquisitive, they are very active, and they are actually in the mood of exploring each and everything around them. So it is very difficult to diagnose the child before age of 5, 4 to 5. And after that, if we see such symptoms consistently, frequently, and intensely in children, then we can say that yes, child has a problem. And there are three different places which usually are seen. It's like at home, in school, and in social situations where the family gatherings are happening, or social gatherings are happening, or any place, park area where the people are there. If out of these three places, at two places, this behavior is happening, then the child can be said that yes, he is hyperactive. But before we just label, as it is mentioned in the title of today's talk itself, the phenomena is really important to understand before we label the child. Especially labeling is a very negative word in psychological problems. Usually, they are the issues or concerns. What we see it as, because the child needs help, and as an adult somewhere we fail to understand what the child is going through. And in many cases it is just labeling what happens, and the child is seen from those color spects, like, oh, this child is like this. And this information gets passed on year after year in the school situation, or even at the playground where the child is going regularly, or even in the family. So it is more to help them than saying or than labeling or than giving some particular kind of a title to the child. So, what are the associated problems? So, the hyperactivity usually doesn't come alone. it has its friends and colleagues also, which usually follow. It's like the behavior problem. As we have seen, the behavior is really difficult uh, because they are unable to control. So they are not doing it intentionally. And many a times I have seen that after pushing any child, or after even after poking, or even after hurting the other child, this child with ADHD usually goes and says sorry to the child who's been hurt. So that time we really feel bad that he's not doing it intentionally. It is not under his control, but still he goes and says sorry that I'll try not to do it again. So the conduct problems are also there. Then socializing issues are there. They are unable. They cannot make friends because the students usually try avoiding such children with such symptoms. Then there are anxiety problems. The child is always been given some negative comment, or they are being scolded. Sometimes they have been hit by the family members or even by the teachers. So they have this anxiety that my any of my action will definitely result into something bad. So that particular thought is always lingering around them in their mind. Then because of their inattention, or because of their uh, like inability to sit for a longer time, the basic and the foundational stages when the child learns to read, write, or do basic math operations, they miss out on the basic concepts. So the learning problem is another issue which we are seeing in ADHD children. Then, as I said earlier, the thoughts are running into their mind. It's like the marathon is happening in their mind. So when they start speaking, their speech is always kind of unclear. Usually speech delay is seen, and when they start speaking, their speech is not clear. So usually children with ADHD problem, they need speech therapist also, in the set of therapists with whom the child works. And as I said earlier, this if this problem is not addressed at the right time, usually it runs even in adulthood, sometimes even after that. Even the senior citizens also sometimes they complain to the psychiatrist that somewhere I'm unable to control myself. So these are the cases which are associated with the hyperactivity problem. What are the causes of this? Heredity is one of the cause. It runs in the family. Then there are problems with the brain. Prefrontal cortex is the place where our filtration about our cognitions and even our behavior pattern happens. And if there is some chemical or functional problem, it leads to ADHD. Then there are several other factors which contribute to ADHD. There are mental health issues in blood relation, in parent siblings, or if there is consanguinity in the family, then ADHD can be there. Then exposure to toxic toxins like lead, then maternal drug use, alcohol, smoking, then premature birth, uh, stress or trauma during prenatal period, epilepsy, and brain injury. This could be the reasons uh, for ADHD. Uh, Bijlani ji, will it be okay if I'll go to two more slides? Because it's already 7.
Sure, sure.
Yeah,
Please go.
yeah,
Complete the.
yeah. Thank you. So the primary assessment, as I was saying, that uh, what is the specific problem? Because when the parent approaches us, it is like they come with all the behavior, academic, emotional problems what they have faced, or what the reaction from the others neighborhood or other relatives or the teachers. So it's like a web of all the symptoms. So we usually focus on the specific problem, what exactly is the behavior pattern. So when writing the clinical history or family the background of all the behavior pattern, we need to find out what is the specific problem. So is there any problem with paying attention or sitting at a place or finishing the given task, etc. Because as I have shown you the slide of the symptoms of hyperactivity and inattentiveness, the symptoms which are given, if this particular behavior falls into that particular list, then yes, the child needs help. So any complaint from the school, usually school is the first who comes with list of complaints. So because anyway, the teacher has to deal with 30 more children or 20 more children with this child or with this girl, then she finds it difficult to deal with any deviation in the behavior. So the school also is very important. Then the duration of the problem, like if it is happening only for 1 week or 10 days time, then we ask the parents to wait. And then we ask them, okay, we'll meet you after some time, maybe after a month. And during that time, we give them some tasks. So sometimes indisciplined and uh, over pampered children are there. Then with the family history itself, we get to know most of the issues, and we counsel uh, parents or the relatives like that, and then we meet again to understand whether the frequency is there and consistency is there. Then what the parents or the family members have done to deal with this problem, that is also very important, uh, because many times we have seen that lot of hitting, lot of scolding, lot of punishments are given usually to these children, and that actually makes the situation worse for that child. So all these things we consider in our primary assessment. Then there are checklists which are standardized and used all over the world for diagnosing ADHD or even for other emotional problems. Actually, the last psychological tool what we use, that is used even for the emotional problems with ADHD. So all these usually are filled by the parents and by the teachers. So in two situations, as I said, out of three situations, we try to cover two situations at least to see the problem is very serious and we need to do some intervention in that process. Okay, so the treatment is behavior therapy. We usually analyze every behavior pattern which is seen in the child, and we try to modify it with various techniques of behavior therapy. Then the occupational therapy is given, like how they have to perform or complete any given task in day-to-day activity. So that is the work what he has to do. But that work will be divided in different parts, and one by one the child has to finish that task given, and then after four particular actions, the child will finish that one big task. So occupational therapy usually works like that. Then the remedial education, especially when I'm saying that the child faces the learning problems, then the remedial education is required. Remedial education is usually given by the special educators, which they are trained to understand where the child has stopped learning, and they start from that particular point and go on to pull the child up to the age level. Then speech therapy, as I have told earlier, that the speech is usually delayed and is not clear. So speech therapy also is required. And in many times, at many times, especially when moderate and severe type of ADHD is diagnosed, then the medication is also required. So usually we send the child to the psychiatrist, child psychiatrist, or child and adolescent psychiatrists, or developmental pediatricians, whoever is available. We send the child for the medication and the medical help. Then managing child with ADHD at home or in different situations. So it's like if we give one particular routine, and as I said, divided into different instructions or different parts, it becomes easy for the child, and the child feels that he has achieved something. And one task is done, and if we praise the child for that completion of one task, the child feels at peace that I have achieved something. He feels happy and becomes very calm. And as he has finished that particular task, he becomes attentive that now I'll listen to the other task which is given. But this is not that simple as I'm saying. It requires a proper behavior and occupational therapy when this can be achieved. But if any parent who is really attentive and who has started working with a child at very earlier age, then it becomes very kind of a routine. And there are so many videos I have seen. The parents are working, and again, I'll go back to this Mithu Pal's video. The amazing work the mother has done. She has devoted her life. Each and every minute she was focused on bringing the child back. So that particular task is required to keep the child on track. Then avoid punishments. It's like hurting the child usually creates a lot of negative and unpleasant sensations for the child, and the child tries to avoid that situation. So try to praise the child even for the small achievement of his, or just recognize that whatever achievement is done. Then give reward or praise the child when the child behaves in the right manner. Break the instruction, give it in a simple manner. Keep a pride file of child's achievement so that the child understands that, like any other child, I also achieve a lot of things. Then reduce a lot of stimulations which are around them. It's like, especially the gadgets, we have to reduce the screen time. We have to keep away this gadgets and give more of the personal touch. There should be one person always with the child who will help the child in doing different tasks. So it becomes very comfortable for the child to move around anywhere, especially in at home and in the school. Then be specific in your expectations from your child. Like even for the day, in a normal scenario, we see that the parent asks the child, like, okay, you have to get up at this time, finish your meal, finish your breakfast, then get ready, go to the school. After going to school, come after coming back, you have to go for this tuition, that tuition. You have to spend some time with your friends on the ground, then come back, study on self study should be like this, and then uh, we'll discuss something at the dinner table and then go to sleep. But in this particular list, we we have told many parents that, see, this list contains so much, so reduce on that. And especially for such children, we need to understand what is the capacity and potential of a child and what should be expected out of the child. So for each child, it will be different. So need to understand the need and the potential of the child, and the tasks should be given. Then the physical activity or the sports is required usually when the sport, some formal game like the physical activity game like badminton or tennis, usually reduces the hyperactive symptoms in the child, and it helps in inducing more and more attentiveness in the children who are having these problems. Then establish a regular routine for a child. Listen to child's feelings and thoughts. It is very important because they usually get a lot of negative comments and feedback from others. So there should be some ventilating point where the child will feel comfortable and he will be rejuvenated or feeling afresh to work and face the next day. Avoid taking child to crowded places or come back home if supervising becomes difficult. So it is usually for family functions or maybe for get-togethers, social get-togethers. This situation happens like the child becomes really difficult to handle. So at least prepare the mindset of a child that we will be going there, and then if you are not comfortable, we'll come back. It is not like saying something that if you start misbehaving or if you will be very indisciplined, not that kind. The same thing, but you can put it in more positive way that see if you start feeling uncomfortable over there because that is the difficulty what child is facing. Need to understand that and come back and just tell him uh, after coming back that next time we'll try to stay more in any such situation. I'm there to help you. So we'll work. So it is like we is very important for such children that somebody is understanding me, somebody is trying to help me. Then plan activities beforehand and instruct the child accordingly. As I said, prepare the mindset of a child so it becomes very easy for the child to face any situation. So this is the presentation. And thank you for listening. And I have taken 12 more minutes. Thank you, Bijlani ji, for giving me those 12 minutes. Thank you.
Thank you so much, Ashwini ma'am, for sharing your vast knowledge on a subject which is very important today for children and more importantly for parents and teachers. I'm sure it will be helpful to all of them. Thank you so much.
Thank you.
Participants, if anyone has a question, please go ahead. You can ask any question. Use the chat box or raise the hand. I'll call out your name.
No, I have some problem with my camera, but I'll try to answer.
I guess no questions today. Dr. Bijlani sir, I request you to share your thoughts, please.
Thank you, Ashwini ji. In spite of all the technical issues that we had at the beginning, you managed to give a very informative talk. And I think it was very important because these days it's we sort of, on one hand, people are becoming more aware of such issues. On the other, we have sometimes gone from one extreme where counselors and therapists were avoided to the other extreme where it has become a status symbol to seek their help. We feel that if we have studied something about a problem, we have understood it, we have discussed it, and we have gone to a counselor, uh, all that was needed has been done. But all that does not really become a substitute for good parenting. So, another thing that I noticed in your presentation was that there can be a lot of overlap between uh, pretty normal children and those who have ADHD. Some of the features which we find in ADHD are pretty common in normal children. And as you mentioned, that we have to have at least this number, maybe I think out of 18, 10 or 12 for the child to be taken as ADHD. And basically, the problem is whether it is a behavioral problem or whether it is an inherent problem because of the way the child was sort of crafted right from the beginning. Is it something which started at birth, or Is it a behavioral issue which has developed later, and also which is precipitated by some situations? I think that is important to understand instead of rushing to a conclusion what the child has. Another important thing is that if the child does have ADHD, then we have to understand that the child is not doing it intentionally. Whatever the child is doing is because the child has no other option. That is the way the child has been constituted, and therefore it is natural and normal for the child to behave that way. Then, in the treatment, you mentioned a large number of things which can be done, one of which was medication. Uh, Sometimes there is a tendency to depend upon medication and feel that if that has been done, then the rest of the things may not be that necessary. So maybe you can answer that question. What percentage really does need medication, and can some attention and effort on the part of parents and teachers avoid medication? And if
Yes.
medication is necessary, then how important it is to still take care of the other things which you mentioned besides medication.
Yes, usually it happens like, as I said, like 18 out of 18, if the 12 symptoms are really observed in the child, or more than 12 symptoms, which keeps the child on the severe mode of ADHD, then the medication is required because, as I said, the prefrontal cortex is not functioning properly, or some functions because of some chemicals have gone down in their functions. So some stimulants are given to the child where the child becomes more attentive for few hours, and then the therapy can be given, the behavior therapy, or even the special educator, if the special educator is working with the child, then whatever learning has to happen for that particular reason, the medication is given. And only with the psychiatrists or with the uh, neurologists help, usually these medications are given, and that is only for few months. It is, we cannot keep giving that particular thing because it has its side effects. Usually the skin becomes dry, or the child is after medication, the child becomes very dull, and usually they lose on their weight and height. So these are the side effects which are seen. So only for few months this particular medication can be given, and after the age of 8, that is what is prescribed, that after the age of 8, not before that. So the learning can happen, and the behavior therapy or the remedial teaching can be done for that particular time. And if the early intervention is done, then with the behavior therapy, ABA therapy, or with help of special educators and occupational therapists, a team usually works. And in many cities now, as I have worked in Pune and Bangalore, even in Delhi also, I have heard that there are centers which have everything under one roof, that from the basic assessment up to different therapies, which I have mentioned in my presentation, everything can be given at one place. So if the early intervention is done, then it becomes easy and no medication is required usually after the age of 8.
Thank you. These are important guidelines. Firstly, try to catch the problem early and start treatment early.
Yes.
And secondly, avoid medication before the age of 8. And medication is not lifelong. It can be for a short period, or at least one can try all other measures. Uh, even after starting medication, one can interrupt it after a few months and
Yes.
see if that it still works.
Yeah, usually this has been advised by the child and adolescent psychiatrist or even the neurologist that should not be continued after certain period of months. It depends on the severity of symptoms. So usually it is measured, and even the weight of the child. Every other parameter is considered and then the medication is given.
Thank you.
Thank you, sir. Participants, I would like to inform that the recording of today's session and all the guest talks that we have every Saturday evening are published on our YouTube channel, Yes Spirituality. You can visit the channel and explore content on yoga, education, spirituality, and related subjects like self-help, wellness, and psychology. Ashwini ma'am, thank you so much. Thanks once again for sparing your valuable time for all of us. Thanks a lot. I thank the participants as well for being with us today. We'll close today's session now with a moment of peaceful silence. Namaste.